Virginia Henderson, The Value of Independence by Sidney Gordon, Emily Anderson, and Julia Tanzer.
Virginia Henderson was born in Kansas City, Missouri in 1987. She spent most of her childhood at a prep school owned by her grandfather. Then, in her later years of education, she graduated from the Army School of Nursing at Walter Reed Hospital in 1921. She earned her bachelor's and master's in nursing from Teachers College at Columbia University in 1932 and 1934. After graduating from the Army School of Nursing, she began her career as a nurse. Her first job as a nurse was at the Henry Street Visiting Nurse Service. She spent about 2 years there working as a nurse. Then, in 1924, she ended up becoming an educator at Norfolk Protestant Hospital in Norfolk, Virginia. One of the things that she did while she was there was went back to school to earn her bachelor's and master's. Once she graduated with her master's in 1934, she became a faculty member at Teachers College. Not only did Virginia Henderson serve as an educator while she was there, one of her main roles also included editing and rewriting a textbook of the principles and practice of nursing. In addition to this, Virginia Henderson served as a research associate at Yale University School of Nursing in 1953. As you can see, Virginia Henderson lived out many of the various roles that you can have as a nurse. Not only was she a floor nurse, she took time to be an educator, took time to publish and to write, and to also research. Some of the awards that were granted to Virginia Henderson for her work include an honorary doctoral degree from a variety of different universities, the Christiane Raymond Prize in 1985, and Virginia Henderson was known as an honorary fellow of United Kingdom's Royal College of Nursing. Virginia Henderson influenced the profession of nursing mainly through her nursing need theory, which we will talk about more in future slides.
Virginia Henderson is most known for her nursing need theory. This theory emphasizes the importance of increasing a patient's independence to accelerate their progress toward recovery, and how nurses can promote patient independence for better patient outcomes. Henderson's nursing need theory it highlights the basic human needs and how nurses can meet those needs to help a patient gain their independence. According to Henderson, there are 14 basic needs in her theory. If you look closely, they do look very similar to Maslow's hierarchy. So the basic needs that are met are initial, and towards the top of Henderson's list are more psychosocial needs. And I'll just list her basic needs off here. Number 1 is breathe normally. Number 2 is eat and drink adequately. Number 3 is eliminate body wastes. Number 4 is move and maintain desirable postures. Number 5 is sleep and rest. Number 6 is select suitable clothing. Number 7 is maintain body temperature within a normal range. Number 8 is keep the body and skin clean and well groomed. Number 9 is avoid dangers in the environment and avoid injuring others. Number 10 is communicate with others and express emotions, fears, opinions. Number 11 is worship according to one's faith. Number 12 is work in such a way that there is a sense of accomplishment. Number 13 is play or participate in forms of recreation. And number 14 is learn, discover, or satisfy the curiosity that leads to normal development and health, and use available health facilities. So again, her first several needs relate to basic physiological needs that everyone must have. and the last few correlate with more higher functioning psychosocial needs that, again, everyone does need to have in order to achieve the best outcomes.
All right, so taking a look at the influence of Virginia Henderson and the nursing needs theory, we're going to start by first looking at the theoretical influence. So, kind of how did she influence this move of nursing theory that happened in the mid 90s? Um, the first piece that makes her kind of unique, and I think just maybe not even unique, but pushes nursing in the direction that it's kind of gone in since then, is that she emphasized the individual as central, and self-care was the goal of nursing care. So really put the patient at the center of things. I think that's probably the language that we would use now, right? Is that we're moving towards patient-centered care. But for her, it was centralizing the individual, and then self-care being that goal. Um, so she frames the nurse's role really as substitutive, supplementary, or complementary to a person's individual function. So she kind of placed that nurse in a pretty humble position in comparison to their patient, knowing that that nurse is only substituting what a person would normally do on their own, supplementing maybe what that person would normally do on their own, or complementing what they can already do until they can do everything on their own. And so, really a push towards that. And then something that was also pretty unique about her is that the theoretical language that she created matched the assessment and intervention language that the nurse was using with the patient to help them grow in self-care, right? So we have this kind of like nurse speak or nurse language that I think we've all been learning over the last 4 months or so. And she really like integrated that into her theory. So the previous slide that you just saw, where Julia talked through like each of those 14 nursing needs, that's the language that we all are really familiar with, and it's really unique to nursing, I think. And so that was another piece that she really influenced, I think, in the theoretical world. She was also one of the first, so she was early on in the nursing theory movement. She was kind of along the same timeline as Pepla and Abdella. Obviously, Nightingale was earlier, quite a bit earlier than she was. But those three, their theories were relatively intangible, and they, I don't know, tended to be more conceptual, had a lot more to do with the therapeutic relationship that the nurse had with their patient. And though Virginia's kind of takes that into account, obviously, because that therapeutic relationship is still important, and she saw that as valuable. The language that she uses really is surrounding assessment and intervention. And so I think that was one thing that, again, pushed nursing theory in a direction that it maybe was not previously going. So that leads into practical influence. When I was reading through research about Virginia Henderson and what she did and kind of what the theory did for nursing in general, people's thoughts and feedback was like, yeah, this nursing theory is a lot easier to implement than others because it is concise, but it's still comprehensive. So if we look at that list of nursing needs, I think, I don't know, 14 is a lot of needs for a nurse to think about on any given shift or for any given patient, right? But I think that they are all encompassing in a way where it's like, yeah, nursing is not a whole lot more and it's not a whole lot less than these 14 things. They are pretty, again, yeah, concise and comprehensive. And then it also uses nursing specific language. So, like I mentioned, that's big, that's important, makes it easier to implement. But it's also like NANDA adjacent. And so the kind of nursing diagnoses that we've been working with for the last 4 months, the language that she used mirrors all of that pretty closely. And so the implementation of things seems easier in that way as well. And then one study that I came on that was actually like really interesting, I think, was training about the nursing needs theory actually resulted in better nursing care. So there was a study done back, it was like between 2013 and 2016, with a group of nurses where they all received training about this nursing needs theory, and then their assessments and interventions were tracked prior to that training and then after receiving that training. And so they were able to see with this study kind of what the outcome was of having an understanding of this theory and what that would actually do for someone's nursing practice. So the results of that theory, or that study rather, yielded a higher percentage of initial assessments completed, and also a higher number of Norton scale assessments completed. So that's a skin pressure ulcer, kind of similar to the Braden scale. So those two assessments were the ones that they saw like the most statistically significant increase in. And then as I read through the rest of the results, there was others that there was increase in assessment and intervention in other areas. They just weren't considered statistically significant necessarily by the like research standards of things. But yeah, super significant increases. I think it was like 92% of initial assessments were completed prior to the training, and that actually went up to like 100% after the training they received. And then I don't remember the numbers on the Norton scale assessment piece, but a statistically significant amount of people increased those assessments completed as well. So understanding this theory and knowing it actually like has yielded better results and higher quality care for individuals who are under nursing care. So that's it. And this slide is just a screenshot from the study that I previously referenced. And we're going to give you a case study in the next couple of slides here, but this was the case study that they kind of created, or the way that they were able to kind of show like, hey, here are Henderson's 14 components of nursing needs. And then here is how that would show up on actual assessment findings. And so I just thought this was like a super interesting like side by side, because again, it does feel really comprehensive, but not like it's too much. Like all of these things are things that we would be wanting to know in head to toe or a functional assessment if we were doing those like upon admission for any given patient. So just something to look at.
Our patient case study follows an elderly woman who unfortunately suffered a broken hip after a fall. She was previously independent before the fall and unfortunately had to undergo surgery and stay in a TCU to recover from her hip surgery and get back to her normal functioning. So I will just read this here. Rosie is an 83-year-old patient who was recently admitted to the hospital after a fall and is experiencing shortness of breath, dizziness, and lightheadedness. Rosie underwent surgery for a broken left hip. Rosie is in the TCU postoperatively until she is able to gain her strength back. Rosie is married and lived at home with her husband Jim prior to her fall. Rosie normally performs all of her ADLs independently, but due to her recent fall, she needs some additional assistance. Rosie is participating in physical therapy and occupational therapy daily and is determined to get back to her normal self. Rosie is Christian and has been praying daily to get better quickly. Her husband visits every morning and eats breakfast with Rosie. Rosie's mood has shifted slightly since being admitted to the TCU. She is showing some signs of anxiety revolving her recovery, but is motivated to do what she needs to do to get back home. So just thinking a little bit about Henderson's theory, the nurse should be thinking to help Rosie gain her independence after this fall, and what steps need to be done to promote that.
When thinking about applying Virginia Henderson's nursing need theory to our case study, I think one of the things that helped the most was reading about Henderson's idea of what it means to be a nurse. When looking at various pieces of Henderson's writing and research, one of the things that she said was, when answering what it means to be a nurse, her response included assisting the individual, sick or well, in the performance of those activities contributing to health or its recovery, or to peaceful death, that an individual would perform unaided if he had the necessary strength, will, or knowledge. I think this quote kind of helps sum up what it means to be a nurse as you're going through the nursing process. For example, when you're thinking about assessment or diagnosis, what pieces of care can you provide to assist the patient in activities that are going to contribute to their health, but also in order to get the patient to a level of independence where they can maybe perform some of those activities, recognizing, however, that some patients are going to be more independent than others. So, as we enter into this case study and applying the nursing theory of Virginia Henderson and to the nursing process, keep in mind Henderson's definition of a nurse and the role of a nurse in assisting individuals in activities to contribute to their health that they are maybe unable to perform at the moment, but also working on getting individuals to a level of being able to work on things that will also contribute to their health or recovery.
So as you begin working with Rosie, you understand that according to Henderson and the nursing needs theory, each patient has basic needs. So for Rosie, she needs help meeting those basic needs. Due to her recent surgery, she needs help ambulating, getting dressed, toileting, and getting ready in the morning. And so the nurse's goal is going to be to help Rosie with those things actively, but then also to work with Rosie to get her to the point where she can fulfill those needs on her own again. And so in our language, kind of now we would think about being discharge focused and knowing that, hey, we're thinking about discharge and self-care kind of right away as we start working with Rosie and assessing her. So then when assessing Rosie, you would be focusing on which nursing needs she can do herself and which nursing needs she requires assistance with, and then working on prioritizing essential physiological needs such as breathing normally. This is going to look like performing a respiratory assessment, musculoskeletal assessment, abdominal assessment, and monitoring her intake and output, and then a psychosocial and functional assessment. So with your respiratory assessment, you're mostly going to be looking at whether she's breathing normally, assessing that first nursing need. The musculoskeletal assessment, you're going to be able to understand more about her movement and posture. You're also probably going to be feeling for body temperature and understanding a little bit more there. That abdominal assessment, you're going to understand a little bit more about elimination of body waste, including that INO as well. That's going to help you understand that. Probably going to learn a lot from your psychosocial and your functional assessment. So you're going to learn more about the ability to eliminate body waste. You're going to learn a lot about eating and drinking adequately. You may also learn something about eating and drinking adequately with that respiratory assessment. You may see some indications there. You're going to learn a lot about sleep and rest from that functional assessment. Selecting suitable clothes and the ability to dress is also going to come in that functional assessment. Keeping the body clean and well groomed, that's going to come from kind of the whole thing, right? You're doing your skin assessment throughout, and so understanding whether or not she's able to keep her skin clean and well taken care of. Avoiding dangers in the environment, that's going to be another piece of functional assessment that you're probably going to learn there. Communication, you're going to be learning this throughout, right? So we're asking a lot of questions. And so her ability to communicate those things clearly and concisely or in a way that makes sense to you is going to be a huge part of the entire assessment. Worshipping according to one's faith is going to come up in that functional or psychosocial assessment, as well as your work accomplishment. Play and participation in forms of recreation is also going to come in that functional, and then learning and discovering or satisfying curiosity in her life. You're also going to get some of that in the psychosocial and functional assessments as well.
The next step of the nursing process is planning. When planning care for Rosie, Virginia Henderson would encourage focusing on 4 major concepts to plan individualized care for Rosie. And those concepts revolve around the individual, their environment, their health, and the act of nursing. So if you were the nurse caring for Rosie, you would work to create a care plan that is individualized and focused on Rosie and Rosie's specific health and her health condition. You would incorporate the environment and how that affects Rosie's journey to recovery. So is she going home to a bunch of stairs? Is she able to use her walker? Um, is she able to have a clean home, or does someone need to come to her home? Things like that. You as the nurse would also assist Rosie with activities that she can't currently do on her own. So that would be incorporating the nursing portion of this care. Um, and again, you would be doing things, according to Henderson, to promote Rosie's independence, and promote her optimal biological, physiological, psychosocial, spiritual functioning, um, and working to get to the goals that have been set towards Rosie's recovery. So things to think about in planning for Rosie would be to continue to have Rosie participate in PT and OT, to help regain her strength before she gets discharged. Again, this would help her physically be more independent. You would assist Rosie with ADLs while still encouraging her each day to gradually increase her own self participation as tolerated. And this addresses Henderson's needs numbers 2, 3, 4, 5, 6, and 8. There's a table on the following slide for reference of these needs. As the nurse, you would ensure Rosie's been taught how to use any ambulation devices that she might have been provided, and you would have her demonstrate how to use those devices to ensure, again, that she can be independent once she gets discharged. You would work with Rosie and also a social worker to ensure that Rosie can communicate her needs and emotions. You're helping promote her psychosocial health and functional health. You're helping her figure out how to independently cope with her new diagnosis and be more independent in working through her frustrations. You would encourage Rosie to participate in activities and group outings at the TCU, again, helping Rosie boost her mood a little bit, gain independence and confidence by maybe talking with some friends at the TCU who might be in a similar situation. And then you would ensure that Rosie's basic needs are met by frequently assessing her, monitoring her vital signs, performing head-to-toe assessments, just ensuring that she is making forward progress physically, and, monitoring for any signs of complication, infection, anything that would be indicative of like her going quote unquote backwards. And again, the table on the next slide is just for reference of Henderson's 14 basic needs.
When thinking about our patient Rosie, keeping in mind Virginia Henderson's nursing need theory, the process of diagnosis involves a couple of steps. First, you're going to think about the assessments that you performed on Rosie and what those assessments told you about where Rosie is and her needs. Second, you're going to think about the needs that Henderson talked about. And Henderson talked about 14 basic needs, including breathing normally, eliminating body waste, sleep and rest, working in a way that leads to accomplishment, and learning, discovering, or satisfying curiosity that leads to normal development, etc. There are quite a few more needs that Henderson talks about. But when looking at Rosie in particular, as a nurse caring for her, we would perform the assessments that were talked about in previous slides, and then use those results to help create diagnosis. In addition to that, however, though, one of the things that we're going to work on is assisting Rosie in activities that are going to lead to and promote healing, and hopefully getting Rosie to a point where she could perform some of those activities and those teachings and things that are going to promote her own healing and recovery. So some of the nursing diagnoses that may pertain to Rosie are readiness for enhanced coping, decreased activity tolerance, impaired transferability and walking, risk for falls, and readiness for enhanced home maintenance behavior. When thinking about the nursing need theory in particular, and Rosie's story, Rosie was pretty independent before she came into the TCU post for her hip fracture. So when you're thinking about getting Rosie ready to go home, keeping in mind this idea of self-independence and involving the patient in care, that's really when the readiness for enhanced coping and readiness for enhanced home maintenance behavior came in. Rosie was fairly independent and seems willing to commit to working hard to get to a place similar to where she was before the TCU. So as your nurse, your role is to be able to help her get to that. And then post-assessment, you're thinking about some of those needs that Rosie might have. And a couple of those needs include moving and maintaining desirable postures, sleep and rest, keeping the body well cleaned, selecting clothes, dressing and undressing. And based on Rosie's status post-op and just her hindrance in ambulating and transferring, decreased activity tolerance makes sense. There's also going to be impaired transfer ability and walking and a risk for falls. So then as your nurse, you come in assisting the individual Rosie in performing activities that are going to contribute to her health and recovery. Some of those activities include getting dressed, performing ADLs, ambulating, participating in PT and OT. So as a nurse, as you're thinking about some diagnoses that would be involved, you would definitely be thinking about that activity tolerance, walking, safety, things like that. And then continuing to incorporate Henderson's needs in her nursing need theory, there is a part of her Rosie's needs that are psychosocial, right? So that idea of like communicating what she needs, avoiding dangers, involving others, participating in recreation, right? That's where some of those even activity pieces come in, and getting Rosie ready to not only physically be in a state to go home and recover, but also mentally and emotionally to get into a state of recovery. When thinking about the nursing diagnosis, the phase of implementation is a phase where I feel like Henderson's theory is super applicable. One of the things Henderson talks about frequently in her writings and her research and the nursing need theory is this idea of providing care as a nurse, but also providing opportunities for self-care. So when thinking about implementing our plan and our diagnoses and our assessments and just implementing care to Rosie, there's a reality of you as a nurse participating in that care, right? Collaborating with physical therapy and OT to help Rosie, assisting Rosie with ADLs as needed, and teaching Rosie about how to care for herself. But there also is a part of that implementation that will be allowing Rosie to perform activities that are safe for her to perform, and she's able to perform without pain. So for example, as we're implementing things, as we're caring for Rosie and we're thinking about the 14 needs and how to get Rosie to a point of being able to reach those needs, one of the things that comes to mind is like getting dressed in the morning and getting ready. Initially, when Rosie's in the TCU in her first few days, Rosie might need more assistance with this. She might be in pain and she might need help performing some of those activities. However, as Rosie's stay in the TCU progresses and as she progresses in her physical and therapy and OT and just healing process, maybe Rosie can do some of those activities on her own, and you as a nurse might be there just for safety purposes or to assess how Rosie's doing and to encourage her throughout that. So that would be a big piece of the implementation process, I think, where Henderson's idea of caring for patients but also allowing patients to perform activities independently would come in. When you're implementing your care with Rosie, another big thing to think about is just promoting her independence and self-esteem. One of the ideas of Henderson is this holistic view, which we see in a lot of theories, but I think Henderson kind of captures with her variety of 14 basic needs. And there is a reality that part of Rosie's care is going to be emotional and mental needs, right? Like encouraging Rosie along her healing, building her up, encouraging her, progress and just being a positive light for Rosie as she heals. And then there is a teaching part about teaching Rosie the importance of continuing those therapies at home, continuing exercises to promote her autonomy and independence. It seems like Rosie, before coming in the TCU, was pretty independent, and we want to encourage her to be that again for herself, and to encourage that self-care aspect of healing. And finally, we get to the evaluation phase of the nursing process. When thinking about evaluating Rosie's care and Rosie's progress, we're going to evaluate the extent of her independence after performing all of our actions. We're going to review Rosie's ability to perform each of the 14 components of the nursing need theory to help develop her progress. So is Rosie able to meet those needs by herself, or does she still need assistance? And if so, what is that going to look like when she goes home, and how can we help her? And we're also going to use that to nursing need theory to determine what resources Rosie will need before discharge, right? If Rosie's goal is to go home, okay, what do we need to send Rosie home in order to meet those needs? Or how do we need to help Rosie get to a point where she can meet those, and what does she need to do that? I think also one of the things that will come with this evaluation is just continual assessments, right? Henderson does a really good job of giving us things to assess, right? Is Rosie breathing normally? Is she able to move and maintain postures? Can she maintain her body temperature? Is she able to communicate her needs? Can she play or participate in various forms of recreation? So part of the evaluation stage will be assessing those needs and how Rosie performs. And if we go back to Henderson's definition of what it means to be a nurse, right? To assist the individual, sick or well, in the performance of activities contributing to health or recovery that an individual would perform unaided if he had the necessary strength, will, or knowledge. So keeping that in mind as we kind of close out our nursing process, with this case study, we're really evaluating, can Rosie perform those activities that are needed, and which ones does she need help with, and how have we as the nurse helped her with those, and how can we continue to help her with those as she goes home and works toward a full recovery and healing.